Hi, everyone. Thank you for joining us for this webinar. We are here to tell you a little bit about how to write questions like those on the ABGC board exam. I'm Melanie Hardy. I'm the current ABGC board certification exam committee liaison, and I'm here with Amy Shikani. She is the certification exam committee CEC chair for 2024. So we're very happy to be chatting with you. Today, what we are going to cover is an overview of the certification exam creation. So all the pieces and parts that go into putting that exam together. We'll talk a little bit about specifically writing items, just the basics of what goes into an item, what the pieces and parts are, and how they work. We're going to go in great detail over some mock items. So you're going to see questions that are very similar to those on the board exam, and we're going to walk you through how those get written and then edited through this process. And then we're going to take some other examples of mock items and kind of analyze them. It's a little give us an example, an opportunity for practice on how to develop these questions so you can try doing this for yourself. Okay, so to begin, the certification exam committee has an overall goal, and that is to develop the exam to test genetic counseling concepts that help demonstrate a certified genetic counselor has the knowledge and skills necessary to competently practice as a GC. In the exam committee, there are kind of different levels of leadership and pieces and parts that put this process together. So the CEC is led by the executive director of ABGC. And then there's a board liaison in this case for 2024, it's me, that attends the meetings of the CEC and kind of helps to communicate between the committee and the board. And then the CEC also has chairs. So currently that's Amy Shikani and Katie Dunn. And then we have the help of a psychometrician. So the psychometrician is trained in statistical analysis of exam development. We're currently working with Prometrics, and they're helping us to design our exam every year. And then beyond that, there are sort of other levels of how this whole thing works. So besides the CEC leadership, we have an entire committee, and the committee is made up of subject matter experts, or SMEs. These are individuals who have spent time writing items in the past. They have experience in doing that, and they're trained at a little bit higher level in order to evaluate the writing of others so that we can really hone down into the most well-written items for the board exam. And then they are also responsible for mentoring item writers. Item writers are also subject matter experts, and they're given assignments to write items that usually correspond to whatever subject matter that they are the expert in, but can fulfill any cognitive level, any type of question that's necessary for the board exam itself. And the CEC is not the only part of how this works. There's really an entire process for exam development. It's a very prescribed process. So we have a governing certification board that oversees certification exams for lots of different professions. And we have to follow their guidelines as far as how this process works. And that's what the psychometrician is really there to help us do, is make sure that we're following all of the right steps to put together a defensible certification exam that follows the rules and gets made the way it's supposed to be made. So we're hoping that this presentation is going to give you some ideas for how to incorporate some exam-like questions. If you're a program director into your program, if you are a candidate, you get an idea of how this whole process works. We, of course, can't tell you about any specific exam items, though you will see some examples here that look very similar to other items on the exam. We can't really discuss any resources or ways to study for the exam, but there are lots of resources on the ABGC website that I would definitely encourage you to seek. Um, and there's nothing about this that would change the process. We have to work our way through this in a very prescribed way because of that governing body, and to make sure that the exam is designed the way it's supposed to be designed for our accreditation to be complete. So in order to generate an exam, it really starts with a practice analysis. And that's where all of you out there come in. When people want to know what is on the board exam and why doesn't it exactly match what I'm doing with my patients right this second? Well, that has a little bit to do with the first piece of this process. So the practice analysis is a survey that goes out to all practicing genetic counselors. And we use that to provide information about current practice. So when you see an email from ABGC that says, please take the practice analysis survey, make sure you do that, because that's your chance to weigh in on what subject matter is going to be important and relevant for genetic counseling practice. From that survey, there is a practice analysis committee, again, made up of subject matter experts and the psychometrician, that creates something called an exam content outline. The exam content outline sort of lays out major pieces and parts of genetic counseling practice. It sort of lays them out, like the bullet points of what it is that we do as a profession. And the psychometrician compares that exam content outline against the current board exam and generate something called a gap analysis. So every time we do a practice analysis, the board exam doesn't get completely remade. It doesn't start from scratch every time. There are a lot of items that have longevity. They're still relevant for today's practice, even though they might have been relevant for yesterday's practice. So some items stay and some items need to be rewritten. That's where that gap analysis comes in. So they look at the current item pool, they outline the gaps, and then item writers are assigned to fill in items, questions in those content areas that are lacking. And the item writers create first draft items. From that point, this is really where the CEC is kind of coming into the mix of this process. So the item writers are part of the certification exam. They're sort of overseen by the certification exam committee. The mentors of the certification exam committee help to provide feedback to those item writers on the written item. They review, they help them edit. There's a back and forth discussion process in trying to get that item in the best shape possible. And then we want to make sure that those items also meet formatting standards and cognitive levels, and we'll talk a little bit more about what that means. Finally, once we get a nice pool of edited, formatted questions, then that goes to the certification exam committee, and we meet in person to look at these items and approve them for use on the board exam. So we continue the revision of those items until we get them to a point where they're really ready for final usage. We try to ensure that those items are correct, timely, and accurate. There's a lot of review that happens, and we'll talk a lot about that in today's presentation. And then from there, they still have to be vetted, which means they go into the board exam as sort of trial questions. Now, the candidate doesn't know which ones are sort of on trial and which ones are going to be scored, but they're all in the mix. And then we use how they perform on the exam to determine, do we need to use it as is if it's good for it performed well, then we keep it and it keeps moving into rotation. If it doesn't perform well, maybe we can edit it to make it a little bit better and check it again to see if it works better. Or if it really performs poorly, we might need to toss that item altogether. But the important part is the candidates don't get scored on those questions. So it's just a matter of collecting data to make sure that the question is really optimum for use on the exam eventually. Okay, so a few basics about writing items. First are the parts of an item. So I keep using that word item. This is really the question, but it's made up of different pieces. So the first is the stem, and this is where we kind of set the scene. It's the who, what, where, when, why behind the question that we're about to ask. And this should include information that the test taker needs to know in order to answer the question. So you can see in this example, the stem includes pregnancy information, pregnancy findings, a little bit of a social context. Honestly, this question could still be edited for length and to be a little bit less heteronormative. So there would, even this example, we could probably tweak a little bit further to get it a little bit more clear. Beyond that, there is the question itself. And this is specifically what the candidate should know or do with the provided information. And the question often informs the cognitive level. So we'll talk more about what that means in the next couple of slides. Finally, there are the answer options. So there is a key, that's the one and only correct answer, and the distractors, those are the incorrect answers. Now, it's important to know that distractors should be plausible. They should be things that, a candidate, if they're really not paying close attention, or if they're really not well-versed in the things they need to be well-versed in to pass the exam, they might actually choose one of those distractors. But the key is the one that is the most right out of all of the choices. So that's really what you're trying to do when you're answering questions on the exam, is finding the answer choice that is the most right, the one that is the most plausible. And it's very, very important to read all 4 choices given to you in order to make that judgment call. Okay, so a little bit more about these different pieces and parts. So first there is the stem, which is the background information. It's really important as you're writing items to consider what is the relevant information that needs to be included. And we try to make this relevant information no more information than is necessary to answer the question. But we also don't want the test taker to make assumptions to get to the answer. We need to provide them with the necessary information. We try to avoid trick questions, questions that maybe require some mental gymnastics for you to get to the right answer. Those are items that we would avoid in the item review process. The stem should be concise. We know that longer stems really test reading comprehension instead of knowledge, which is not the goal of the board exam. We want to test knowledge. And we try to avoid teaching in the stem. This is something that on the CEC committee, you learn to spot like a hawk. So these are places where bits of information might get connected and potentially provide an answer to a future question on the exam. So for example, a patient's under evaluation for Marfan syndrome, the genetic counselor orders FBN1 analysis. Well, if that information were in a stem, it's telling the test taker that Marfan syndrome and FBN1 are connected. So that's teaching them. We try to avoid that because it creates what's called enemies with other items. All right, the question. We want to make sure that candidates can understand what's being asked of them. So the question needs to be very clear. We avoid negatively worded questions. So for example, which of these answers is not the right answer? We don't have any questions like that. There are also no combo answers. So, choose A and B, A, B, C, none of the above. Those are not answer choices that we would put on the board exam. A couple times I've mentioned cognitive levels in this process. So there are ways that we kind of evaluate the questions that are written for the exam, and they fall into one of three buckets. So I'm starting at the bottom. A recall question has one cognitive step. So usually these are things like definitions or a simple description, or really it's just where to get from question to answer, it's a one-to-one. One equals the other. When we move up to the next level, application, it takes two cognitive steps to get to that answer. So a person may apply some bit of information along with what they know in order to put those together and arrive at the answer. And you'll see lots of examples of these later on, so you'll get the hang of how this works. But converting, modifying, predicting, concluding, interpreting, etc. These are all application type questions. Finally, analysis is where we're really stepping it up. So it takes 3 and sometimes more cognitive steps to get from the question, the information that's there in the question, to the correct answer. So it's really a matter of synthesizing multiple points of information, solving a problem, ultimately determining the correct action to take in order to answer the question. So there's just a little bit more work that has to be done to get from question to answer. And on this slide, I've got a few examples so you can kind of see how this works. So in this recall question, 2 individuals, pathogenic variants, same gene, one is more severely affected than the other. This is an example of. This is really a definition question. It doesn't often require any kind of clinical scenario. We don't need lots of details in the question. It's really just define, a concept. So they're pretty straightforward. Application question, remember, includes 2 cognitive steps. So in this case, child dilated aorta, genetic testing, what causative variant, and then you pick your gene. So what the cognitive steps are is, sort of what is in the differential diagnosis for aortic dilation, and then second, what gene would be associated with that disorder. So there's a couple steps to get to the answer. And then finally, analysis. This is where we get a little bit more involved. Child with hypotonia, developmental delay, exome sequencing, family option for secondary findings, should be informed that secondary finding may be identified that's associated with. Now, the steps that are required here is which disorders can be identified on whole exome, which disorder is on the ACMG secondary findings list, knowing the difference between a secondary finding versus a primary finding, what kinds of conditions might be associated with those. So it takes a little bit more effort to put all the pieces together and arrive at the right answer. And then the key. So the key, remember, is the right answer. It should be the only right answer. And our item writers have to have sources to support that is in fact the right answer. So relevant practice guidelines, information from relevant textbooks that are used in genetic counseling programs, primary literature, gene reviews. The right answer should not be practice specific. So for example, an answer that would be true for a GC that's practicing in a large academic center versus something different that would apply to somebody in a small rural hospital. That's not a great key if there would be a difference for those 2 individuals. And just a little note for you, the ABGC website has a resources list. We are currently in the process of condensing this list to make it a little bit more easy to navigate, but definitely check the ABGC website for resources if you need any in terms of prepping for the exam. All right, and then on to the answer choices. So first, the distractors. Remember, these are the wrong answers. Distractors should be similar to the key, though, in many respects. So they should have similar length, similar style, similar complexity, grammar. We don't want a test taker's eye to be pulled away to a particular answer just because it's different looking than all the rest. It's also important that these distractors are less correct than the key. They still need to be plausible, but they need to be definitely less correct than the one correct key, the correct answer. So the distractors might be incomplete. They might be only partially correct. They might be missing some necessary information to make them correct. Good distractors make fine distinctions between somebody who really understands what they need to understand to be a practicing genetic counselor and those that can't make those fine distinctions. So some examples, just to give you an idea what this looks like. In this question, patients referred for cancer genetic counseling. In the session, the patient says, "I hate you, you're controlling, just like my mother who died of cancer." This is an example of. And you're given 4 different answers there. C is the correct answer. But there are a lot of problems with these particular distractors. Number one, they're not all the same length. A is like a lot longer than all the rest. Technically A and C could both be correct. So that's problematic. C includes extra information from the patient to the counselor. If somebody knows what transference is, we don't really need that extra bit of information. It also gives a hint to the test taker about what transference means. So we wouldn't want that because it's teaching. Distractor D actually has 2 counseling terms where the others are all just one term. And the question of like B, is B really a plausible distractor? So lots of issues with those particular distractors, but if we wanted to fix them, you could actually clean that up quite a bit. Transference, countertransference, grief avoidance. And these are all relatively the same length. They're all single counseling terms, are all similar terms. They're all plausible, but there's still one correct answer. And then in the process of evaluating items, we're still looking for a lot of other things. It's important to know that the certification exam committee goes through DEI training and implicit bias training. So we're trying to make sure that those people who are evaluating items for the board exam are avoiding issues of implicit bias. So we want to check items for that and try to correct it whenever we see it. When appropriate, we might use person first language. This can change sometimes depending on the type of question that we ask. We want to involve or avoid stereotypes, heteronormativity, ableism. We want to remember that we should be including some non-traditional families, LGBTQ considerations. We want to incorporate that so the board exam is really as representative of real life as we can get it. We also try to make sure our terminology is up to date. There are certain words to avoid, like normal or the word Caucasian. We're trying to get those things out of the board exam. Terminology like variant versus mutation. We try to make sure questions are written in the third person and avoid other common mistakes, like making sure we're only asking one question. We have one correct answer. We want to reduce length and wordiness, make sure we're not using trick questions, no negatively worded questions. We're testing an important concept. There's a whole lot to consider when it comes to putting this exam together. And that's a heavy lift for the members of the CEC. And the good news is, as subject matter experts, they are and well trained in doing this, having had years of experience writing items and doing that in the past. The group that we have is really well suited to try to put together the best possible board exam that we can. Now, remember that all the members of the CEC are still human. There are still some problems with the board exam, but we're working as much as we can year upon year to try to fix those as we go. All right, Amy.
Great. Well, thanks, Melanie, for giving us a very broad overview of how the exam is created and how items get on the exam. So we are going to go back a little bit to the beginning, where what an item writer would be given following the gap analysis that results from the practice analysis. So this might be a way that an item writer is assigned an item to write. They would be given a part of the content outline. So in this particular example, this item writer was given domain 1A3, which focuses on differential diagnosis or indication. And they were asked to write a recall question, which is the most basic one-step question, as Melanie taught us. For this question, we are going to use gene reviews as a reference because every item has to have a reference. So here is a draft that an item writer might share initially with their mentor. A 55-year-old man of European descent and his 42-year-old wife of South Asian descent bring their 3-year-old daughter to genetics clinic for evaluation. The pediatrician had previously ordered a karyotype to assess for a chromosome disorder, which was negative. The child has developmental delays, supravalvular aortic stenosis, growth deficiency, and an overly friendly personality. What is her most likely diagnosis? You can see that we have the key as Williams syndrome, and the distractors provided were Noonan syndrome, DeGeorge syndrome, and 11q terminal deletion disorder. And so as we go through this item, the first thing we want to do is edit it. As Melanie explained, we want to get rid of things that are unnecessary to answer the question. So we can take out the age and the race because they're unnecessary. We can also think about what is not needed in this question in terms of, is it important that the individual is a man or that his wife is of South Asian descent? Those pieces of information are not necessary, so you can get rid of them. Also, this item is very lengthy. And so again, we don't want to test reading comprehension or teaching. So anything we can do to further edit down the length of this stem is exactly what we want to be doing. The information about the pediatrician previously ordering a karyotype to assess for a chromosomal disorder is teaching. So if an individual has another question on the exam that talks about what type of testing is needed to assess for chromosomal disorders, and the answer is karyotype, that answer would be provided in this question. And so we want to take out that bit because it's not necessary. Finally, when we look at the distractors, distractor D really draws your eye because it's a different length and it's a different style. It is a chromosome deletion disorder, and it doesn't have the word syndrome at the end. And so ideally that would be changed to be more in the style of the other distractors as well as the key. So here is an example of the initial item that we saw on the last slide. After it goes back and forth between item writer and mentor several times, it might end up in this form. So as you can see, it's much shorter and only asks the necessary information. So now it reads, a young child has developmental delay, supravalvular aortic stenosis, growth deficiency, and an overly friendly personality. What is the child's most likely diagnosis? And we changed distractor D to be Jacobson syndrome. And so now that is a more plausible distractor. The item contains only the information you need to answer. There's no teaching, and all of the answer choices match in style and length. Anytime we write an item, we always want to go back to the content outline and ensure that the resulting question in the way that it has been edited and modified still fits into the assigned content outline where it needs to fill that gap. So again, we were aiming for differential diagnosis or indication, which this question still fits. It's not at all unusual for a question to also kind of fit into a different part of the exam content outline. So I think people could also argue that this could fit under 1C1 clinical features, but the best place for it to fit would be in 1A3 differential diagnosis or indication. And so we were able to fulfill the gap for this particular item assignment. Now we're going to manipulate this question to think about it in terms of the cognitive level. So first, as you reread this initial question that was on the previous slide, think about how many steps it takes you to get to the cognitive or from a cognitive perspective to get to the answer. It goes from symptoms to disease. And so this would be a basic one-step recall question. Next, here is the question slightly modified in a different form. The first sentence of the stem is still the same, but the question has now changed to change the content or to change the cognitive level. So the question now states, which test is most likely to identify the child's diagnosis? So you can see that the key is obviously the correct answer, FISH for 7Q11.23, but the distractors are also plausible. So in this circumstance, there's another FISH for a microdeletion, and then there's two options of gene sequencing, which can have some symptom overlap. So for this example, there are two cognitive steps. You go from symptoms to disease, disease to test methodology. And finally, we're going to take it up to the highest cognitive level. So again, the first sentence of the stem is the same, but we've modified the question to say the child's diagnosis is molecularly confirmed. We don't say how, we just say that it was confirmed because we want to avoid teaching. And then that continues, what should be recommended for the child's unaffected parents? And the key in this one is no further testing. But again, all of the distractors are plausible. So if you think about the cognitive steps that you go through in this particular question, you go from symptoms to disease, disease to test methodology, and then what would be recommended in terms of risk or evaluation for family members. And so this would be the highest cognitive level of analysis. Okay, so now we are going to do a little bit of practice item development. And Melanie and I are going to do this section together. And we're hoping that as we go through this piece, you can pause and do some of this work on your own as well.
Yeah, so let's take a look at the first practice item. This is an example of something that we might receive from an item writer in its, initial form. So I'll go ahead and read the question. The consultant 3-2 is a 20-year-old Hispanic female who is pregnant with a son at 15 weeks gestation. She comes to clinic seeking genetic testing for a family history of retinitis pigmentosa. Her mother died at age 24 with no known symptoms, and no one in the family had genetic testing. She's particularly concerned about whether her baby may develop retinitis pigmentosa in the future. Given the information in the pedigree, what is the most likely inheritance pattern of retinitis pigmentosa in this family? And then you're given the choices: autosomal dominant, autosomal recessive, mitochondrial inheritance with homoplasmy, and X-linked recessive. So upon initial analysis here, we want to look at, are there any issues with this question? Anything that really jumps out as far as things that maybe we need to revise or edit in this question before it moves on to being used in an exam? So one of the things that kind of jumps out to me is the word consultant. We have that word, it's a word that kind of jumps out at you right in the first question. And then you get pointed to who the consultant is. So in a way, this is teaching you. It's telling you a little bit about what a consultant is. So if we happen to see that word later on in the exam, the person might remember how these things are connected, and we want to avoid teaching.
There's also some teaching going on in this item in terms of what RP is, and I think we can cut down on that to avoid it being an enemy item with other items that could be put on the same form.
Yeah. And related to that, I mean, this is a long question. There's a lot of kind of unnecessary information here. So for example, do we need the age, the race, the gender of the patient, the gestational age or the sex of the baby? These are all a lot of details that maybe don't relate to the question whatsoever. And if so, then we can consider them unnecessary information and start editing those away.
Definitely. And then looking down at the answer choices, the thing that draws my eye is option C. It sticks out. It's not the same two-word answer as the rest of the choices. And so I think that distractor should definitely be edited to be more in line with style and length of the others.
Yeah. And there's another thing in terms of the actual question itself. The question asks, what is the most likely inheritance pattern? And you see this in some of the questions on the board exam where we might, in this case, we would want to highlight or capitalize the word most in that question, specifically because we want the test taker to know that because the distractors still have to be plausible, there's always some remote possibility that maybe one of the others could theoretically be true, but the question doesn't ask what is the only possible inheritance pattern here. It's asking what is the most likely inheritance pattern. So it's really drawing the eye to, really thinking through, looking at that pedigree and deciding what's the one that makes the most sense when we're evaluating this question. So we would capitalize the word most and, again, edit down to avoid testing for reading comprehension, so that's not what we're testing. We're testing the knowledge of the test taker. So what we want you to do, if you're willing, is take a minute here. If you want to, you can pause this video. Give it a shot. How would you edit this question to rewrite it? Given the information that's there, how could you rewrite this to be a little bit cleaner given some of those problems that we mentioned?
There's not one right answer here, so just take it in the direction that you're most comfortable with.
Okay, and if you're coming back from the pause, this is one example of how we might have edited this question. The question now becomes, what is the most likely inheritance pattern demonstrated in this pedigree? So in truth, do we really need the name of a condition? Do we really need any of that other information? A lot of it was just unnecessary, and we can get this right down to the most simple, straightforward question possible. Yeah, so here's another test for you. If you had to guess what cognitive level this one fit, what would you guess? And the answer is recall. So this is really a pretty straightforward inheritance pattern. Look at a pedigree, one equals the other, And so it's just one cognitive step. Now, if we wanted to move this along to a different cognitive level, that's practice number 2 for you. If you tried to rewrite this in a different way, so that, let's say, the next cognitive level up is application, 2 steps from question to answer, what might that look like? And again, you can take a minute to pause, work on that, give it a shot, and we'll come right back. Okay, so back from that little break. This is an example of an application question. One possible way you could rewrite this to move it from 1 cognitive step to 2. So in this case, what condition is most likely to be represented in this pedigree? In this case, the test taker has to make the connection between the inheritance pattern that they see and then connecting that to which of the conditions on this list fits that inheritance pattern. And in this case, you know, A and D are both recessive, B is X-linked, and then C is our dominant example. Okay, time to pause again if you'd like to try this, to try to move this into an analysis question. Now, this is where, when you're trying to move it to 3 or more cognitive steps, this could go in any possible direction. We're going to show you our example in this in the next slide, but take a minute, pause, try it for yourself. Yours might look absolutely nothing like ours. That's okay, but give it a shot. Okay, so here's an example of an analysis question. In this case, what we did is we said individual 3-2 seeks genetic testing for family history of Fabry disease. This was identified through genetic testing involving a rare variant. The patient has concern about a potential affected pregnancy, gestational age 6 weeks. What's the best first step to take in this case? And the 4 choices that you're given are all plausible. They're all things that you could potentially do given the information that you have available. But there's one that really sticks out as the most right answer. And one thing I will say about this new question, you know, Amy and I had just tried to generate some questions that we could use for this video, so for a little bit of practice time. One thing you'll notice about this one is I actually switched up. Fabry disease is X-linked. So that's something that the test taker would have to know, that there are some examples where that same pedigree could still apply to an X-linked disorder. And then I added some information that this was a rare variant. So it makes answer choice B the most correct answer out of the others. Some people might lean towards choice C, but given that it's a rare variant, that might not be the first thing that you want to do. All of that being said, is this a perfect question and answer? No, it could still probably use a little bit of evaluation, a little bit of editing. And this gives you a really good example of how this is a tough process. It takes a lot of experts in the same room to try to make questions as well written, as you know, testable, things that are going to perform well on the exam, that really identify differences between people who are ready to be certified genetic counselors and individuals who are not. It's a tough process, and it takes a lot of work to try to get to the best possible questions. But the more you practice, the better you get. And so this hopefully is a good exercise for you to give it a shot.
Okay, so let's do it again. Here is practice item number 2. And again, this might be an example of where the item starts. So a 47-year-old Asian American woman with aortic root dilation and ectopia lentis is referred for possible Marfan syndrome. The woman had a history of aplastic anemia, age 12 years old, and underwent a bone marrow transplant from a matched donor sibling. Analysis of what gene is most likely to diagnose this patient. And obviously, the key is FBN1 sequencing. So, again, the first thing we want to do is go through this question and figure out how we can make it a better question. The first thing that I would pick out is that, as in similar examples that we've used on this presentation, aortic root dilation and ectopia lentis in evaluation for Marfan syndrome is teaching. And so that's something that we would want to get rid of in this item.
Yeah, additionally, the age, race, gender of the patient, that's really pretty unnecessary information. You don't need it to be able to answer the question. So a lot of that can be pulled out.
Absolutely. And then the woman's history about the reason for needing a bone marrow transplant, unnecessary to what's being asked in the question, as well as who the donor was, doesn't need to be included in this question.
Yeah, something else you'll notice in the answer choices, they all say the same word, sequencing. So whenever we have a situation like that, where the same word gets repeated over and over in all of the answer choices, we can actually move that into the question itself so that it just takes away some of the redundancy and some of the extra wordiness.
And finally, from a stylistic perspective, anytime we have a gene in the exam, it's always italicized. So that would just be a stylistic change that needs to be made. So those are some of the things that we would highlight in terms of editing this item. But if you want to take a second to pause and work your own magic to get this item whipped into shape, we'll show you what we came up with in a minute.
Okay, so coming back from the pause, this is an example of one possible way you could rewrite this question. Given that there was so much in the item itself that was just unnecessary information, you can really skim that down. So in this case, we wrote sequencing of which gene should be recommended in someone with features of Marfan syndrome, and you have your 4 answer choices.
And
So
again, if you want to think about from a cognitive level, how many steps it takes to go from the question to the answer, hopefully you get that it takes one cognitive step. And so this would be a recall question.
correct. And again, if you want to pause one more time, we're going to try to move this up to the next cognitive level application. So remember, that's 2 steps from question to answer, 2 cognitive steps. So take a pause, try it for yourself, try rewriting, and then we'll show you what we came up with.
Okay, so here is the item rewritten in one possible way. We rewrote the question to now give that the patient has certain features, aortic root dilation and ectopia lentis, and asked sequencing of which gene should be completed. And so again, this would be a 2-step process because you have to recognize what these features are associated with and then what gene needs to be tested. So one more pause if you'd like. We are again going to try to bump this up to application. So if you'd like to have a go at it, we will show you what we came up with in a second.
All right, so here's an example of an analysis question. The patient with aortic root dilation, ectopia lentis, and history of bone marrow transplant should undergo gene sequencing of. And in this case, we changed up those answer choices just a little bit to add not only the gene name, but how the testing should occur on what kind of a sample.
And obviously, some of the initial information from the first iteration of this question comes back with the history of the bone marrow transplant so that people have to think about what testing type would be the most appropriate. So now, again, when we're thinking about cognitive level, we're going from clinical signs or symptoms, the aortic root dilation and the ectopia lentis, matching that to Marfan syndrome, remembering what gene is associated with Marfan syndrome, and then going one step further to remember that individuals who have had bone marrow transplants cannot have testing on blood or saliva, and so skin fibroblasts would be the correct answer in this particular question. And again, these questions can go in any possible direction. And that's part of the fun part about item writing. So if yours looks very different from ours, that's okay.
So we hope that all of this practice has been beneficial for you, that, you know, if you're looking forward to taking the exam, that you have an idea of what goes into this process and what kinds of how the exam content outline gets used, how the cognitive levels get represented on the exam itself. And if you're a program director or somebody who writes questions that, you know, are used on exams for genetic counseling students, we hope that you found a lot of value in this process just to learn how you might try to write some questions. I want to direct everyone to the ABGC website for more resources and information about the exam. There are a lot of things there. We got a new facelift recently, and I'm really excited for you to check out our new website with all of the various resources that are available.
Lastly, this whole process is run by volunteers. And so we are always looking for people to get involved along the pathway of item and test writing. So please volunteer to be an item writer. Please do the practice analysis. Please volunteer in any way that you think might be helpful, or if you want to learn more.